Welcome to the show. I'm Susan Sikora. Most of us would prefer not to think about old age, especially our own. But baby boomers began hitting 65 last year, dramatically growing future demands for Medicare. You may know what this government plan covers if you have an elderly parent. But a crash lesson in Medicare can help you prepare for the day you depend on it. To that end, meet elder care advisor Esther Koch, founder of Encore Management. She gives seminars on caring for aging parents and planning your own senior years. With a degree in gerontology, Esther was a delegate to the last White House Conference on Aging. She is a Medicare Network Aging Partner with the Administration on Aging and the Centers for Medicare and Medicaid for the Medicare Prescription Drug Program. Esther Koch, welcome.
Thank you very much. It's a pleasure to be here.
Well, it's quite an intro, and mostly probably also because of Medicare, because it seems like a maze, and people get very confused by it. Why?
They do, because you can't make it simple. And my goal has always been to make it clear for people.
Why can't you make it simple? Why there's this government program that supposedly takes care of you when you're 65 for your medical needs if you don't have insurance. That's everybody's understanding. Is there anything wrong in that to begin with?
Nothing's wrong with that at all, but there are nuances and requirements for enrollment and requirements on when you have to sign up, and there's specific hurdles that you still have to meet through it.
Okay, and the politicians are arguing about this, and I'm sure we'll hear more in the coming political year, right, obviously, or the one that we're already in. But let's go through the things the way they are now. First of all, people who are, let's say, in the 55 and older bracket, or people who are about to approach 65 or getting there, the boomers that are starting to get there at the beginning. Will anything change in what is going to be available or what is expected at this point for them?
Well, there are some provisions of the Affordable Care Act that are impacting Medicare, specifically reductions in the payments to Medicare Advantage plans. So if less money is going to those plans may reduce some of the extra services that they're currently providing.
So what's the Medicare Advantage plan?
A Medicare Advantage plan is one of the options that you have under Medicare. And maybe we should step back.
It sounds like we're picking from a menu, Plan A, Plan B, Plan C.
Exactly.
Okay, so where do we
start? We have an alphabet of plans, plans A, B, C, and D. So Medicare Part A covers hospitalization.
Okay.
Part B is medical, so that would be doctors, outpatient services, lab tests.
So if I go to the doctor, Plan B covers me.
Correct.
If I go in for appendicitis surgery, Plan A covers me. And I would have both or not?
You would have both. So A and B is how Medicare started, which is now why they call that original Medicare.
Got it.
1965. Then what came into effect was Part C, which is these Medicare Advantage plans, which are actually a managed care alternative. Part A and Part B, you can go to any Medicare provider, a Medicare-approved provider, and it's on a fee-for-service basis.
Okay.
Part C gives you the option of being in a managed care environment, and those the government has outsourced to private health insurance companies. So you would actually enroll through a company, but it is indeed part of the Medicare plan.
So wait a minute. So C and D means, in other words, I can't go to the doctor of my choice. I have to go to the doctor in the plan.
Exactly.
And A and
just
B?
C. Just C.
Just C.
Not D.
Okay. So C means I've got to go to,
that's right. So that's the managed care alternative, which is more restrictive in who you can see. It's usually a specific geographic area that it covers.
Okay.
So frequently it's not available in rural areas.
Okay.
However, sometimes it has extra benefits like some dental, vision, eye care, which is not required to be covered under Medicare.
Is there an advantage to picking C over the AB?
You really have two options. Do you want to have a full flexibility in going to any Medicare provider, or are you willing to take a managed care approach? So that's really the options.
Doesn't it seem like the first one would be the best because it gives me more choices?
More choices, and most people do take that. So of the 49 million people that are on Medicare, some 25% are in Medicare Advantage plans.
And why?
The rest are in original Medicare.
Why would people choose the C then with the limited choice?
Because it has had additional services provided.
Because you might have the dental there.
You might have the dental, you might have the vision, but as I mentioned, that might be exactly what's pulled away from Medicare Advantage plans in the future because those plans were overfunded by the government. So that's why they're going to be funded less going forward.
And what's D?
And D stands for drug.
Oh, okay. So that's your prescription.
That's your prescription drug
So if you're very, very healthy, except you have high blood pressure and you need a high blood pressure medication, D covers you.
D covers you. You have to sign up for it, and there are two options on that also. You would have a standalone Medicare prescription drug plan, or it's incorporated into a Medicare Advantage. So this Medicare Advantage plan usually has drug coverage with it. So it's an all-inclusive type of plan.
I'm getting lost already. Is there a place, a website, a .gov website where this is all explained in English, not medicalese or legalese?
Well, you have the Medicare.gov website.
And what kind of a job do you think they do? Oh, pregnant pause.
Pregnant pause.
Drive a Mack truck through that one.
I think that the government does a very good job at providing information to lower income families. They really are focused on that, but I think that a lot of middle income and upper income families, there's not as much directive to that group of potential beneficiaries.
And directive in the sense that they don't push them in the right direction for where they should go?
Right. I think there's more hand-holding on the Medicaid side. The Medicaid side is for lower income, and that's something people get confused with. Medicare is the health insurance program. Medicaid, and that is for anyone over a U.S. citizen over 65.
Over 65.
Medicaid is based on income and resources.
Okay, we're going to take a break. When we come back, we'll find out a little bit more about this, including Medicare is not completely free. A lot of people think, oh, I just turned 65 and get it all for nothing. It falls out of the sky. Not quite. We'll straighten that out. And also, how much paperwork do you have to save? This can be a nightmare if you're caring for an elderly parent. You know what I'm talking about, the folders. Stay with us. Welcome back. My guest is Esther Koch, and she is an elder care advisor. Why did you get into this in the first place? You were a CPA, weren't you?
That's right. That's right. I was. I had wonderful role models of aging growing up in my grandmother and then subsequently my mother. And then as a CPA, I was on the tax side of the business, and I find Medicare just to be very much like tax code. So that's kind of the interest in Medicare, but it was from a personal, wonderful role models of aging growing up.
So, and also, so if you can decipher the IRS and all their rules, you can, Medicare should be at least a walk in the park. Maybe a rainy day walk in the park, I don't know. Okay, Medicare, a lot of people think when they get to be 65, do I have to do anything when I turn 65? Will the government come find me and say, hello, we're here for you?
The government will come find you if you're already enrolled in Social Security. So if you took Social Security between age 62 and 65, then they will enroll you in Medicare A and B automatically.
And if you did not do that, then you have to seek them out.
You have to seek them out.
How do you do that? Do you go to an office? Can you do it online? Can you call them up?
All of the above. So if you are want to enroll in A and B, and don't want to enroll in Social Security at that time, you can do that online.
Okay.
If you only want to enroll in Medicare Part A, which is generally free to people who are employees who have worked for 10 years, even if you're covered under a company plan, you might want to enroll in that anyway because it's additional coverage. So if you only want to enroll in A, you should call up Social Security. Enrollment is through Social Security, and get an appointment and go into one of your nearest office.
If you are working, whether it's full or part-time, does full or part-time make a difference? It might be
not so much with your how your company plan would cover you. It would make a difference.
So, and let's say you're working full-time, whatever it is. You're working, but you do not, your employer does not offer you health insurance. You don't get that. Then you should go for A and B?
Well, then you might have an individual plan, and probably the terms of that individual plan, once you turn 65, it no longer covers you. So that would be a time where you would decide you would sign up for A and B. You would also sign up for Part D if you wanted to go with all of the options for your medical and
for the drugs,
medical, but then you would add a Part D prescription drug plan. And then because Medicare doesn't pay for everything, there are what's called gaps. And so the private insurance industry came up with a product called a Medigap plan. It is not part of Medicare, but it ties into Medicare. Those plans are approved by the government, and it will cover you for the gaps in Medicare. So usually someone who wants fee-for-service would get Medicare A, B, a standalone drug plan, and a Medigap plan. Or they would sign up for a Medicare Part C, Medicare Advantage plan that has drug coverage.
Okay. There's a cost for this.
Yes, there is.
I know my mother's on a fixed income, but she pays a certain amount every month out of her, out of what she makes there, to Medicare.
That's correct.
All right.
Probably comes out of her Social Security check.
It does. All right.
Yes.
And so most people should expect to see a chunk of Social Security go into Medicare once they hit 65, yes? If they sign up?
Yeah, currently the premium for Part B, again, most people get Part A free if they worked and supported with had paid FICA taxes.
Right.
Part B is around $100 a month. A Medicare prescription drug plan, average price is $30+ a month, but the range is considerable, anywhere from maybe $15 to over $100 a month. So those are the premiums. And then a Medicare Advantage plan, you would still have to pay your Part B premium, but there may indeed be a premium to that plan too.
What about the Medigap? How much is that
And
usually?
the Medigap plan would have a premium to that.
Okay, so and roughly, is there a range of that, or is it all over the boards?
Medigap plans, again, they're not part of Medicare, but they are also in the alphabet. They are consistent across state as to an A plan that is sold in California is the same as an A plan in Texas. However, what's different is the premium on them and how the premium changes over time.
Okay. All right. What about the doctors in this? I mean, I was telling you before we started, I have a nephew who's very passionate about being a doctor. He's in his, I think, almost late 30s now. And he's got a little boy, and he really wanted to be a doctor, and he is, and he's a good one. But he told his mother, he said, you know, he says, if my son ever came to me and said, I want to go into medical school, he says, I would try to discourage him at this point. Why? Because of all this paperwork and business side of medicine. I mean, yes, somebody's got to absorb the cost, that's true. But it seems like, he says, that you get bogged down in a lot of this stuff, and he wants to practice medicine, just. And what do you say?
Well, I think anyone who decides they want to practice medicine, that's their career choice. So in any job, I think there's going to be an administrative side of it, whether you have your own business or not. I would say that the government is trying to encourage more and more people to go into primary care medicine. There's really a need for more primary care physicians. So there's going to be encouragement in terms of reimbursements for education and payments made to doctors that go into primary care under Medicare.
One last question. I need your quickest answer, and that is, when you get this paperwork after, let's say you're managing this for an elderly parent, and your parent has gotten some care, whether it's a doctor's visit or a hospital stay or what have you, and you get the thing that says you owe the provider nothing. Do you need to keep all that paper anyway, or can you throw it away?
I would keep those explanation of benefits for a certain period of time.
And what's that period of time?
You know, maybe several years, and then after the point in time where they pass away, I would throw them
Then
out.
you can go. Okay. All right. Well, we hope we've straightened it out for you a little bit. Esther Koch, I want to thank you. And your website is?
Encore Management, www.encoremgmt.com.
Okay, and Esther's also doing an evening at the Commonwealth Club on March the 26th at 5:15 on the Market Street facility there. And the website there, if you want to get more information on that, is commonwealthclub.org. That's commonwealthclub.org. Esther Koch, thank you so much.
Thank you.
All right, stay healthy.